Everybody makes fun of a person who's snoring, but snoring can be a red flag for a condition that is known as obstructive sleep apnea. Now I wanted to tell you about this. In this condition, a person who's snoring at a point, that snoring goes to a point where the breathing stops, and then after a few seconds and that person wakes up. If you ever come across any of your near and dear ones who go through such cycles of snoring, sudden stop of breathing and then suddenly waking up with this kind of a sound, please see your nearest ENT clinic and get this condition evaluated. It is very important that it is treated at an early stage so as to prevent complications. It would be sounding very far-fetched if I say that snoring and sleep apnea can cause blood pressure problems, it can cause heart disease, but it is very, very true. Many patients with heart conditions, we have found it could have very well been prevented if we would have treated the sleep apnea part earlier. Here in DOCIB clinic, we have a very nice ENT setup. We carry out these nasal endoscopies, laryngoscopy procedures. We have a nice endoscopy unit here. In this, we assess the sleep apnea cases, but besides that, any other obstructive pathology of the nose and sinuses. Even the laryngoscopy is used for voice-related problems or foreign bodies, like fish bone getting stuck in the throat is a very common problem. So please remember, snoring is not a laughing matter. Please pay attention to that. Thank you.